The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Welcome to me, Warriors. I am Tony Urbanic, and we are gathered here for the next edition of TMD Demystified. Today, my topic is very near and dear to my heart, and hopefully when I finish what I have to say today, it'll be very near and dear to your heart. Very interesting topic, somewhat controversial. It seems like I never get to do many episodes that don't have some level of controversy associated with it. But this one is, I think, somewhat controversial because the topic is something that is well accepted, seems to be well accepted in dentistry and in other areas of medicine, that really doesn't hold water for various reasons. And what I'm speaking of is Botox. Now, I am going to spend the next 30 minutes, I promise not longer than 30 minutes, describing what I know about this, what has been known about it, how this is used in the treatment of TMD, and why I've gotten to the point where I find it absolutely necessary to talk about Botox when I claim to have developed, basically a new technology from the standpoint of figuring out really what's going on regarding temporomandibular joint symptoms, multiple symptoms. It's not about the device itself. It is not about this device so much as it is what really is going on with TMD that is not well disseminated, is not well represented in the literature, which boils down to, if you unload the temporomandibular joint adequately, the inflammation diminishes, at which point all of the symptoms associated with TMD diminish. So you're attacking the actual common denominator or the cause of the problem and not just symptoms. And as I've said on many other episodes, up until this time, everyone is focused on symptoms and just trying to diminish or treat symptoms. And Botox is a good example. When I say Botox, I mean botulinum toxin A, which is the generic. I don't want to stir up the Botox people that I'm picking on them. I mean, there are other trade names associated with botulinum toxin A. But first of all, let's get into, what is out there, and that is that many specialists like myself, oral maxillofacial surgeons, and general dentists, and multiple other kinds of medical folks, nurse practitioners, physicians, assistants, try to use Botox in various ways other than cosmetic. So one of the ways it's being used is to treat the symptoms of TMD, which is primarily limited to pain, and pain in a specific area. And the theory behind it is that if you have an area of the face or jaw or neck that is painful, that you paralyze the muscle so that the muscle does not go into trismus, or the muscle does not feel tight, or the muscle does not cause pain, and that takes care of the problem. Well, what's lost on that theory is actually what is creating the pain, and that is its muscles don't have pain fibers in them. When a muscle goes into trismus, it pulls on the periosteum where the nociceptors are, and the pain is generated at the level of the periosteum. So that's where the pain is coming from, and that is why a injection of botulinum toxin A will decrease pain in that area. You paralyze that muscle. For example, let's just say the masseter muscle, and that there's pain right there. So you do your injections into the muscle. The muscle is paralyzed. It does not pull on the origin and insertion at the zygomatic arch and the inferior border of the mandible and the lateral aspect of the body of the mandible. And that pain will go away for a period of time until the botulinum toxin A, quote, Botox, wears off, at which point it needs to be repeated every 3 to 4 months. And that is what is being done increasingly regularly throughout the dental profession. And it's very remunerative for the doctors, and that stimulates them to go in that direction. And it's very well advertised and marketed, because the botulinum toxin A folks have lots and lots of money to do that. Now, so that is what's going on in our profession and our industry right now regarding Botox and why it is being used. But the reason I bring this up, the reason I want to speak on it, is the fact that in our practice and in the other practices that use our device and protocol for the treatment of TMD, but especially in our practice, frequently I will be somewhere in the middle of a consultation, and the patient will look up at me and say, "Dr. Urbanek, what about Botox?" Because they have heard Botox is the solution. And basically they ask me, "What do you think? What do you think about Botox? I'm listening to you and what you're telling me, but what about Botox?" My answer has got to be a fairly standard answer and then a standard explanation. My standard answer is, it's a scam. That is my standard answer at this point. It's a scam. And then I go through, depending on how much time I have and how busy I am seeing patients, I will go through a period of time explaining why I believe that it's a scam. And I do. So let me go through the reasons and the discussion that I have with patients, and I try to make it brief, but this discussion will be just a few minutes longer, as why I truly believe that Botox is a scam, and I have for quite some time. First reason is, and I tell the patients, is that Botox is not approved by the FDA for its use in temporomandibular joint disorder, TMD. It's not approved. So that tells you something right off the bat. Why, you would question, well, why doesn't the FDA approve it? Well, I guess you'll need to actually contact the FDA and let them tell you why, because I'm not going to make things up that aren't necessarily true. But in their review of the reasons why botulinum toxin A is approved, it doesn't seem to be appropriate to prove it for the treatment of TMD. So if you are a doctor, medical doctor, dental doctor, nurse practitioner, who injects Botox for the treatment of TMD, you are on your own. You do not have the support and approval of the FDA to use it, and you're using this drug off-label. So if you have a misadventure, and the misadventures can get rather severe, there are multiple episodes of injecting that drug in or near branches of the facial nerve, at which point, or even at the trunk of the facial nerve as it comes out near the temporomandibular joint and deeper, that you can paralyze the nerve, which will take quite a bit of time, 4 months to even 6 months to recover. And in some unusual and admittedly rare instances, the nerve does not recover or does not recover completely, and you can end up with permanent facial dysfunction lack of motion of the face. But when it happens even temporarily for 2 or 3 months, you are left with a facial muscle deficit that can appear similar to Bell's phenomenon, Bell's disease. And that's terrible, and that happens. And when you do that, then you leave yourself open for legal action. And there have been and are multiple doctors who have been and are being brought into our legal system and sued because of the use of Botox and inappropriate Botox for temporomandibular joint disease. Again, if you want to use the drug for cosmetic reasons and for wrinkles, of which I have lots on my forehead, and if I didn't want those wrinkles, it would be easy to Botox the frontalis muscles, and those wrinkles would go away, and I wouldn't be able to do that anymore. I have no problem with that. My problem is using it for TMD. So that's the first reason, and I tell the patients that. The second major reason is that I have observed, unfortunately, several lectures from my colleagues regarding the theory behind and the use of Botox for the use of temporomandibular joint problems. One in particular that happened years ago, and this is where I began formulating my opinion about the use of Botox in TMD, and that was one of my oral surgery colleagues in a very relatively big room, state meeting with lots of oral surgeons in the room, and she was promoting the use of Botox and went through, how it is used and the drug itself and that, it wears off every 3 or 4 months. And at the end, and she made it really clear that the best part of using Botox for patients with TMD is you can count on them coming back every 3 or 4 months, inferring that you had another fee every 3 or 4 months built into the whole system, and that you didn't actually fix anything indefinitely, and that they would be back and your fee would go on continuously, literally forever. I found that personally, at the time, and I still do consult. I find that insulting. And I know that my colleagues who are using Botox kind of snicker, and they're aware of that, and they know that that's really a big advantage for them financially. And I don't find that comforting regarding the ethics of my colleagues, but it is what it is. So I tell the patient that, and then I usually, if I have time, tell them about a couple of my prior patients, who have used Botox continuously or in the extreme and what comes from it. And I have 2 examples that I use fairly frequently. One was a young woman, no older than 28, maybe 25, who presented to me with typical symptoms of headache, earache, jaw pain, neck pain, but she worked for a plastic surgeon. And she presented to my office with because of her constant pain of the masseter muscles, the temporalis muscles, facial muscles, which were associated with her headaches and earaches and jaw pain and shoulder pain. She had access to large quantities of botulinum toxin A, Botox, and her entire face was Botoxed, and she couldn't smile. I mean, literally, and her skin had no wrinkles in it, and it had a shine to it. Literally, the light in the room shined off her face like the moon. But she was sitting in my office with no facial muscle pain, but all the other painful symptoms and history of symptoms associated with TMD. So there you go. It attaches, it addresses or attacks certain areas, but ignores all the other symptoms. And that is a major problem, besides the fact that my colleagues snicker that these patients will always come back. The second patient was even more egregious, and that was an older woman. She was in her 40s, who had all of the symptoms associated with TMD: headache, earache, jaw pain, neck pain. had some fullness in her ears also, shoulder pain. And she, in the middle of the consultation, shared with me the fact that she had used Botox for years. Of course, she was sitting in my office with a long history of Botox. She says, I have used Botox for 10 years. And I said, wow. I said, tell me about that, because obviously it hasn't been successful. She said, well, depends on your definition of success. She said, any particular area that was Botoxed, injected, those particular muscles were paralyzed. It didn't address any of the other muscles. But what I wanted to tell you is that over 10 years, I have spent over $200,000 on Botox. I and my insurance company, is what she said. I was stunned. I was absolutely stunned. I can't say that's impossible, because she said, Dr. Urbanek, I have the receipts if you'd like to see them for $20,000 of Botox per year for 10 years. So that's $200,000. So I'll let you make up your own mind whether you think that is appropriate. Obviously, that's the reason the folks who promote and advertise botulinum toxin A, Botox, everybody knows it by Botox. Everybody calls it Botox. The other brands don't have half a chance on getting it out. It's known as Botox, almost generically. Nobody talks about botulinum toxin A. And is $200,000 like appropriate for something that works at best locally and only temporarily? I think not. And for that reason, I knew it was a scam. I mean, I thought it was a scam. My opinion is a scam. I think it's unethical. And unfortunately, for anyone who is listening to this, I stick by it. I just think it's unethical behavior to do something like that when it isn't appropriate and doesn't address the problem itself and just a localized symptom for just a short period of time. But and this little soliloquy happened multiple times a month in my practice. I mean, at least once a week, 2 or 3 times a month, something like that. People come in and they, because we see so many patients. So what about Botox? Well, I recently got the final word on my opinion of is Botox a scam? And so to share with you, and this is the reason why I'm doing this today, in this month's journal, that's April Journal 2024, volume 82, number 4 of the Journal of Oral and Maxillofacial Surgery, JOMS, the lead article on this journal, as I scan my journal for this month, for articles I'd like to read, has the title article the title of the first article this month is, Does the Use of Botulinum Toxin in the Treatment of Myofascial Pain Disorder of the Masseters and Temporalis Muscles Reduce Pain, Improve Function, or Enhance Quality of Life? That is the title of the article. And this article is extremely well documented and extremely well analytically reviewed. Obviously, it's a peer-reviewed article. JOMS has taken a very, very strong stance now about carefully peer reviewing all articles, and especially and writing them appropriately. We have a new editor in charge of appropriating and editing the articles themselves, and he's on a mission to make sure that all the articles in JOMS meet certain standards, and I admire him for that. And I can see in this article he has started out really well with this particular article on Botox. And I wanted to share the results of this article. And again, I say it's written by practitioners and academicians whose standards are extremely high, and analytical review of this is extremely well put together. So no one is going to be able to question the validity of the results of this article. So I'll just read you a couple lines from it, and anyone who would like to get a copy of this and you can't get access to Journal of Oral and Maxillofacial Surgery, contact me, text me. I'll give, I always give my email at the end. Email me and tell me you'd like a copy, and I'll be happy to send you a copy. But first of all, this article went through all of the separate and distinct steps that need to be reviewed, including an institutional review board review of the study itself. IRB was done. And I'm just going to read you the conclusion of the abstract, and then we're going to read a single paragraph within the body of the article, which I think will explain the findings of the article. And then you can read the rest of it yourself. It runs about 11 pages. But the conclusion in the abstract, I'm going to read it verbatim. Onobot A, which is shorthand for botulinum toxin A, Onobot A and saline placebo injections both decrease pain and improve jaw function in subjects with MPD. In other words, where the study took a series of patients, divided them into two arms, and one was injected placebo, saline, and the other was injected into those muscles, masseter and temporalis, Botox. And what they found was the results were identical. You could inject saline or you could inject Botox, and you got the same result. Let that sink in. Like Elon Musk, let that sink in. Let that sink in. So I'll just go on and read the paragraph that I wanted to read, which actually was in the beginning of the discussion, which further states, the purpose of this study was to determine if Onobot A in subjects with MPD can reduce pain, improve function, and enhance quality of life. The results of this study suggest that both Onobot A and saline injections are equally efficacious in reducing short-term pain. And we already talked about Botox reducing short-term pain. Admittedly, it does that. If you have any muscle in the body and you paralyze it with Botox, it is not going to pull on the periosteum wherever the origin and insertions are, and therefore will reduce pain. And if you reduce pain, you will increase quality of life for that short period of time until the Botox wears off. The Onobot A, the onobotulinum toxin A wears off. I admit that, I agree with that, but that doesn't mean it's not a scam. I'm going to read this again for effect and let it sink in, of an article that is peer-reviewed and peerless. I mean, just perfect article. The purpose of this study was to determine if the use of Onobot A in subjects with MPD, myofascial pain dysfunction syndrome, when it's questioned about that definition as it is, can reduce pain, improve function, and enhance quality of life. The results of this study suggest that both Onobot A and saline injections are equally efficacious in reducing short-term pain. So skip the Botox if you really want to just reduce the pain in that particular muscle for that particular length of time, then just inject saline. So in my mind, it enforces certainly my opinion, but in my mind, Botox is a scam. And this article proves it. And that is what I wanted to bring to your attention today. And why I wanted to bring it to your attention. Yeah, I never will feel, and I haven't felt that practitioners, dental or medical, using Botox for the treatment of temporomandibular joint disorders is any sign of competition to what I've discovered and what we do here in our practice, and with the many growing number of doctors, network doctors throughout the United States who use the Urbanic device and protocol. I don't even consider it competition because I know it's a scam. And sooner or later, I felt that the entire story would come out. The entire story would come out to the public and to our profession. And that is why I made this episode today, to bring it to the forefront of the profession. And it needs to be brought to the forefront of the population too, because it's inappropriate. It's just inappropriate to do. With that being said, I'm going to wrap it up. If you are a doctor who would like to treat TMD successfully, truly, and you'd like to address it by addressing the cause, not the symptoms. The cause is inflammation within the temporomandibular joint. We all know that nonsteroidal drugs, nonsteroidal anti-inflammatory drugs, decrease inflammation within the temporomandibular joint, along with the rest of the body, over a short period of time, and can be used, are effective only a short period of time, then you might want to consider using a device and protocol that decreases the inflammation within the temporomandibular joint, localized to the temporomandibular joint, not the entire body, that decreases inflammation within the temporomandibular joint, the actual cause of all the symptoms that create the effect over a long period of time, like indefinitely, if you use it according to the protocol, which is 24/7 for the first 2 months and nighttime only the rest of your life. Using this device, which unloads the posterior teeth and can be worn and spoken with, speak with it, comfortable, and understand how it works. If you'd like to get involved and be a network provider, then you can contact myself or our Director of Education and Marketing and COO, Naomi Williams, or myself, or look at our website, which is www.urbanictmj.com. We got a couple different websites. That's the practice website. If you want to learn more about becoming a network provider, it's www.urbanictmj.com. My address is tony@tmjservices.net, TONY@tmjservices.net, Naomi, NAOMI @tmjservices.net. Each of us will be happy to communicate with you and tell you how you can become a network provider and send you whatever information you'd like to learn about our company and our product and our service. With that being said, I hope this has impinged upon the listeners. I hope it's meaningful. Again, let that sink in. It blew me away. It actually blew me away when I opened up this month's journal and saw that article and what it was about and what it proved. It proved its point. I just read it to you. It blew me away. So I look forward to speaking with you next time. And I hope to find at least an equally interesting topic to talk about the next time we talk next Tuesday morning. With that, I will say this is TMD Demystified, and I am Tony Urbanic.